Believe it or not, but one of the factors underlying my decision to become a physician was a mosquito. Have you ever seriously thought about a mosquito? You probably haven't if you live in the United States or one of the industrial regions in the world, as a mosquito is simply an annoyance. It's something that buzzes around our head on a summer night. It's something that interferes with our picnics or barbecues, and if we get a bite, we simply put some cream on it. But for many people in the developing world, getting a mosquito bite can be a significant event. I've seen this firsthand. It happened suddenly. My mother developed a fever, became pale and weak, and then the hemorrhagic rash began. It started soon after we returned from a family vacation abroad. It was my first time in what is considered a third world country, and truly the first time I saw the difference between the affluence of the American lifestyle and the reality of life for many people around the world. We stayed in a luxurious hotel with pristine landscapes, air conditioning, clean water supplies. But to really get a good feel of the true part of the country, we spent a lot of time exploring the rural countryside where most tourists didn't frequent. And I was shocked at the stark contrast that existed beyond the hotel gates. The local townspeople employed by the hotel lived in cinder block houses with tin roofs. They relied on questionable water supplies and were frequently seen 3 to a bike traversing unpaved roads and dangerous bridges. And the local healthcare clinic was miles and miles away. It was truly an eye-opening experience for me. Back in the United States, my mother battled with dengue fever. She was incapacitated and bedridden for weeks. Fortunately, under the medical care in the United States, she soon recovered. But the fact that a small mosquito precipitated such a health crisis in her really left a lasting impression on me. I couldn't help but reflect on how severe her illness had been, as well as the fact that this disease is endemic in a number of countries around the world. It really highlighted the intimate relationship that exists between one's environment and one's health risks in developing regions. Moreover, I couldn't help but wonder what would have happened if my mom was part of the local community, a community that had limited access to health care. Would her health outcome have been different in that case? My subsequent experiences living with indigenous communities in remote regions around the world continually reinforced this relationship I was seeing between one's environment and one's health. Living with the communities, I saw many people struggle day to day to achieve what I thought were basic necessities: clean water, shelter, sustainable food sources, and healthcare. And regardless of the geographic or cultural experience I was having, these themes seemed universal. Taken collectively, these experiences, along with my philosophy that an individual can make a difference, underline my decision to become a physician and to focus my efforts on improvement of healthcare access and quality both nationally and abroad. About 100 years ago, my great-grandparents immigrated to the United States. They did not have healthcare access in the way we think of it today. My great-grandmother delivered twins in her kitchen without prenatal care. My great-aunt had a tonsillectomy in her own home. And my grandmother battled against diphtheria while a quarantine sign hung on her front door warning people away. We've clearly come a long way in the last 100 years in the United States in terms of healthcare quality and access. And it is my passion to see that these advances are also made for families in developing regions from both a sustainable as well as culturally sensitive approach. I'm excited to be a finalist. My participation in this program, I believe, will be important in my development as a physician as well as a global health professional, as it will give me firsthand field experience and a medical mission. Additionally, it will cultivate a better understanding of the challenges and barriers that exist for effective healthcare intervention for some of our most vulnerable global communities.